And it looks like we have most of our panelists here and ready, and a number of our participants have joined. So let's go ahead and get started. Thanks everyone for joining today. Our AB Nexus Research Blitz, the first of hopefully many activities that will help with connectivity across our campuses. Just to introduce myself, if we haven't met before, I'm Kristen Krasuski. I'm a research partnership specialist working on the Boulder campus as part of the AB Nexus initiative, and also wanted to introduce my colleague and counterpart, Diane.
Hi all, thank you for being here. It's exciting to launch this grant program with this Research Blitz activity. Very excited to hear about all of your research. As Kristen said, I'm Diane Liddell over at the Anschutz campus.
So just a few housekeeping things. Again, if you're not presenting, please mute your microphones, and we'll get started here. Presenters, you'll notice in the bottom right-hand corner, we'll give you visual cues at the 2-minute, 1-minute, and 4-minute mark to let you know where your timing is. If anyone has any trouble joining, hearing, seeing slides, please send a chat message to Diane, and she can help navigate through any challenges. So without further ado, I would like to introduce our first speaker, Juan Park. Juan, take it away.
Thank you. Good morning, everyone. My name is Juan Park with the Electrical Engineering Department in Boulder campus. I want to present our project targeted on developing nanomaterials for bladder cancer therapy. Bladder cancer is the 6th most common cancer, and the current therapy was originally developed 40 years ago, and it remains rather ineffective with a recurrence rate over 40%, and is also expensive. So our research goal is to develop a nanoparticle cluster that can simultaneously detect subclinical cancer and, upon detection, kill cancer cells selectively. We believe bladder cancer is ideally suited for this nano technology-based approach because bladder is accessible. We can administer the drug directly into the bladder without systemic exposure. Bladder cancer cells also overexpress epidermal growth factor receptor, or EGFR, offering a nice target with which we can target cancer cells specifically. So for the technical approach, we develop multifunctional nanoclusters composed of gold nanorod for cell killing and upconversion fluorescence nanoparticles for fluorescence detection, and antibody to EGFR for cancer cell targeting. We have conducted a series of in vitro experiments with which we demonstrated selective binding with EGFR positive cancer cells and selective killing of cancer cells by thermal ablation or optoporation. We have also demonstrated efficacy in mouse models. We are continuing the mouse studies now, and we are also planning to expand the animal studies to canine models in collaboration with a team at Colorado State University. We are also conducting a series of experiments to evaluate the safety of our materials. The team consists of Professor Thomas Flake at School of Medicine at Anschutz campus. He is an oncologist, and he is the leading investigator in the animal study. And also Professor Jared Brown, School of Pharmacy at Anschutz campus. He is a toxicologist, and he is leading the safety study. We are looking for potential collaborators with expertise in immunology, pathology, and surgery, among other things. Currently, the project is funded through the Spark REACH program, and we will be seeking further funding from NCI and also some venture capitals. The expected outcome will be a novel therapy for bladder cancer, and we believe this approach will be readily applicable to other cavitary cancers with presenting a similar anatomy as bladder. as I said, bladder cancer is the sixth most common cancer, so the potential impact on health will be pretty high, and the potential market worldwide is expected to be over $2 billion per year in the next few years. Thank you.
Thanks, Juan. Next up, we have Nivedita Naresh. Nivedita, are you joined? Let's see if we can follow up with her, Diane, and move on. Svenja? I believe you're still muted, Svenja.
Sorry, I had trouble with my unmuting. Here I am. Okay. Yeah, my name is Svenja Knappe, and I'm an associate research professor in the mechanical engineering department in Boulder. And my research centers around small quantum sensors, and for the past many years, we've developed miniature magnetic field sensors. And they, by now, rival the performance of cryogenic sensors. So squid magnetometers are really the best magnetic sensors that are out there. And we're developing a technology that does not need cryogenic cooling. And instead, they're based off the use of light and the vapor of atoms. And they're called optically pumped magnetometers. And the technology itself is not new, but we're trying to miniaturize them with microfabrication technologies. And so we have used these sensors. So we've developed sensors and sensor systems, and we've used them successfully for measurement of non-invasive brain imaging and also heart imaging. So magnetoencephalography, MEG, or magnetocardiography. We have a current R01 NIH research grant that is a collaboration between our group in Boulder, the group of Isabel Ward, who's at the MEG Center at Anschutz, and also Mark Spitz, who's a neurologist at Anschutz. And then we have an external collaborator, Laurie Parkin, and the goal of this grant is to specifically develop a brain imaging system based on these novel LPM sensors that can be brought closer to telemetry. So right now they're big stationary equipment, and what we're trying to do is to move them into environments where the patient can actually move with these sensors. Right now this is all still in a shielded environment, but the long-term goal is to take it out of the shielding and develop a method where you can do brain imaging in much more realistic paradigms. And so what we're interested in is to take this into other applications as well, either brain imaging applications or other biomedical imaging applications. Right now it is mostly focused on epilepsy, but MEG is used for a variety of diagnostic methods apart from epilepsy, such as non-degenerative diseases, mild traumatic brain injuries, but also for, let's say, fetal cardiography. And so what we're interested in is to see, are there any other potential collaborations or advantages for other applications that could benefit from having a magnetic imaging system that can be either more mobile or can allow new paradigms, or something that we haven't even thought about yet. One advantage of these sensors is that they're not in a stationary doer, so you can get closer to the source. You get usually bigger signals than you can with the current MEG technology, and potentially better images with that. And so we are very excited about the current collaboration we have, and we're really hoping that we can push this forward to really go into this unshielded environment where at some point we're not constrained by the shielded room anymore, but also into this environment where the patients can move. That's all I wanted to say. Thank you.
Thank you very much. And I think I saw Nivedita join, so we can pop back.
Hi. Hi, so I'm from Children's Hospital, Colorado. My expertise is in cardiac MRI methods, accelerated cardiac MRI imaging. My project was to be able to use deep learning methods to accelerate pediatric and fetal MRI. So traditionally, there have been several compressed sensing algorithms that have been used to accelerate imaging methods. And it has been, but most of these compressed sensing algorithms have mostly been applied offline. And so the image reconstruction times can be anything between like 1 to 4 hours. Sometimes it can be a few minutes too, but it can be up to 4 hours as well, especially for 3D reconstructions. So recently there has been the emergence of deep learning methods where they use the databases of the images that have already been collected over several years to train these convolutional neural network models or CNN models. And the image reconstruction times are accelerated up to where the image reconstruction can be done within just a few minutes. But until now, the deep learning methods have mostly been applied for other purposes such as image classification, image segmentation. There have been very few groups who have been looking at applying deep learning methods to image reconstruction. There have been a few, most of them, but there are only a few groups that have been looking at these techniques for image reconstruction methods. So my project was to be able to apply these algorithms to accelerate pediatric and fetal MRI methods. For both these imaging techniques, anesthesia is a problem. And the goal is always to sort of reduce anesthesia times and to be able to sort of achieve push-button MRI, where you can sort of have like a free-running framework and acquire all the images without the need for anesthesia. Essentially, that is the eventual goal. But until now, that's obviously it's not clinically possible. We still do need anesthesia, as it's difficult for kids to hold still. But with the application of deep learning techniques where we can use the databases of the images that already been collected over the several years to accelerate these imaging times, I think it's a possible eventual goal. So I'm looking through this research blitz. I was hoping to find people with deep learning expertise who would to apply these techniques to pediatric and fetal MRI methods. So this would essentially be performed in like 2 main steps. While one would be, we already have some compressed sensing techniques which we have been applying offline. There have been, recently there have been some vendor optimized techniques as well. And, but these are mostly applicable to like very specific methods such as Cartesian methods. So, my goal was to be able to compare the traditional compressed sensing techniques to deep learning techniques and see how much we can push the image reconstruction times. So this would be achieved in 2 main steps. One would be to develop, first would be to see which deep learning algorithms apply the best for pediatric and fetal MRI methods, and then to be able to use that for multiple imaging techniques, such as for the first application is generally cardiac function, because that is sort of the most broadly used method for pediatric and fetal MRI to diagnose congenital heart diseases. So that would be the first application to see what deep learning methods would be able to be applicable for these. And then once we have sort of a pipeline established where we can use these deep learning algorithms, the same algorithms can be applied to all the other spectrum of cardiac imaging, or even like the entire body imaging, neuroimaging techniques. So that's the attractive part of deep learning, where it is very broadly applicable to multiple imaging techniques.
Thank you. Next up, we have Andrew Goodwin.
Hi, everybody. Thanks for joining this session. My lab is in the Department of Chemical and Biological Engineering at CU Boulder. And it started, we make a lot of materials, and we specifically focus on the interface of those materials. One question we got interested in is that if you build a contrast agent, something that can absorb external energy like ultrasound or light, can we do anything with the energy that was absorbed? And so what we've done in my lab is design these interfacial structures that promote cavitation, which is the formation of a gas bubble. And when you do this at physiological conditions, the bubble collapses, and if it's on a particle, then the particle will move at a very high velocity, like meters per second. And so this has this has an important result. First of all, it can enhance things like photoacoustic imaging, but then it also can result in the formation of channels into tissue. And so we're looking at this as a potential way to enhance delivery of drugs and other therapeutics into areas that are traditionally very hard to access. So solid tumors are, of course, a classic example. We also want to look at musculoskeletal tissues. So right now, the collaboration team is myself for doing the light conversion to cavitation. We're working with Jen Cha in the department to try to synthesize gold nanorods with these structures. And really the expertise that I would hope to look for is definitely someone on the pharmacy side who can understand the challenges of getting molecules, particles, antibodies, et cetera, into these tissues, and what we need to do to tune our structures. Currently, we have funding from NSF to look at the basic science side of turning light into propulsion and what kind of tissues we can move through. And then we would like to pursue some kind of higher dollar funding. Do you mind pushing it back? Putting some higher dollar funding through NIH, and that of course would depend a little bit on the collaborator. So on the technical approach side, we've shown that we can get particles with specific surface structures. We can convert ultrasound energy, specifically high intensity focused ultrasound. We can convert light energy. I would imagine if we tried a little harder and made the right particles, we could use magnetic energy with alternating magnetic fields into these unstable bubbles. We need to evaluate the efficacy in animal models, of course, and I should put them in the team. We have proposed working with Todd Pitts in GI oncology with PDX models. We'd also like to expand to all-in-one delivery agents. So one thing we were anticipating was that these nanobullets, if you want to call them that, would create transport channels, but then they could also be used as delivery agents in and of themselves. Okay, so the outcomes, as I've already talked about, we want to deliver therapeutics and potentially immunostimulatory agents into hard-to-treat areas, and the impact would probably be in chemotherapy of unresectable cancers, so pancreatic and brain definitely come to mind, and then potentially improving post-surgical outcomes of musculoskeletal repair. So in areas where we can't get good blood flow, can we increase the amount of transport and potentially deliver to these hard to treat areas? And that concludes my slide.
Thank you. Next up, we have Antonio Porras.
Yep, I'm here. Good morning. My name is Antonio Porras, and I'm an assistant professor at the Department of Biostatistics and Informatics in the School of Public Health here at the Anschutz campus. My background is in computer and biomedical engineering and machine learning, and I also have a PhD in medical image computing. So today I'm here looking for a collaborator in the Boulder campus to work in one of the projects that I'm doing right now. So currently, most head malformation syndromes in children are identified after the visual evaluation of abnormalities, usually when they become obvious or when children develop severe symptoms related to brain growth constraints. When it comes to their surgical treatment, the approach is also subjective and almost a surgical art. So the outcomes are very depending on the expertise of the surgical team, because there are no objective and personalized metrics or references to target during surgery. During the last few years, I have been working on the creation of automatic methods to analyze and characterize the head in children, both normal and pathologic. These methods can now identify and quantify local head abnormalities with very high accuracy, either from CT images or from 3D photographs. As a result, they can bring objectivity into a currently subjective patient evaluation and treatment. What the project is missing is a graphic interface that can make possible the translation of all these technologies for clinical use and for clinical research purposes. My goal here is to identify collaborators who could help us creating the user-friendly interface to this end. On the developing side, current methods have been designed using state-of-the-art libraries for medical image computing and computer vision, such as ITK or BTK. And most of the code has been written in Python 3. So starting from these developments, we would like to create a modular graphic interface using WX and OpenGL for user interaction and visualization. The current team is formed by 2 other members in my lab and a list of surgeons from the departments of plastic surgery and neurosurgery at the Children's Hospital, where I also have an appointment. My lab works very closely with the surgeons, and they are very supportive of this project as they know the potential to improve the clinical practice. The collaborator that we want to find here would bring into the team the expertise that we don't have on software and graphic user interface development. So the project is currently funded by the National Institute of Dental and Craniofacial Research through an R00 award. This covers the development of the methods, which are ongoing, but not the clinical translation. As the project keeps growing, there is also a lot of potential to receive additional funding from federal agencies. So in addition to NADCR, there's NICHD and NIBIB at NIH, or also the NSF, are institutions for which we could explore future funding, as these methods will enable analyzing pediatric cranial development and how it is affected by the presence of different pathologies, genetic factors, or even ancestry. In terms of outcomes, the software is going to improve significantly the clinical management of patients with cranial pathology and will provide clinicians and scientists with a quantitative framework to advance research in the field as well. More specifically, it's going to enable low-cost, non-invasive, radiation-free automatic screening of cranial pathologies through the use of 3D photography. It will also provide a quantitative evaluation, diagnosis, treatment, and follow-up of patients whose current assessment is subjective and often differs among institutions and surgeons. And ultimately, this quantitative approach will help identify pathology early before children develop symptoms that can be severe and that will affect their quality of life. If we are successful translating this into the clinic, it will help position in the University of Colorado also as leaders and innovators in quantitative diagnostic imaging with a particular focus on craniofacial development. And finally, I just don't want to forget mentioning the potential that this kind of technology could have in the healthcare market, as it can significantly improve the management of patients with pathologies and syndromes affecting cranial development. So thank you for the opportunity to present here, and I hope I can hear from any potential collaborators. Thanks.